All right, on this slide, we are going to take a look specifically at lymphoblasts. And I am starting out on 10x, and that's to give you a picture of what the overall white count is on this patient, which is definitely elevated. So just looking here, we can see in this field quite a few more white blood cells than we would see in a normal patient. Okay, now going up to 40x, now I don't want to move the field too terribly much here because I have it set in a specific spot. But what I want you to pay attention to is that on a normal peripheral smear, the most numerous white blood cell would be a neutrophil. But if we look here, just going up and down, we are not really seeing very many neutrophils at all. In fact, we are seeing what look to be lymphocytic cells. Okay, so I'm going to go up to 100x oil, and we're going to take a close look here at these two cells that are right in the middle. Okay, let's turn up the light a little bit. All right, so the cell that, the focus of this video is the cell on the top. And the one on the bottom is just a normal neutrophil. And the reason I want both of them here is because we're going to use that neutrophil to help define what that lymphoblast is. So when we think about white blood cell maturation, usually the earliest stage that we would see in the peripheral smear, not normally, usually abnormally, is a blast. So either a myeloblast if it's a myelocytic cell, or a lymphoblast if it's a lymphocyte. So this particular patient has acute lymphocytic leukemia. So it kind of makes sense that we're going to see an increased number of lymphocytic cells like we looked at in the previous field. So now what makes this a blast? So blasts, the things that we look at when we're trying to determine an immature phase or stage of a white blood cell is we look at the overall size of the cell. We look at the nuclear chromatin, if it's fine or clumped, because usually immature cells are going to have finer chromatin than more mature cells. And speaking about size, blasts tend to be the biggest stage, and as the cell progresses or gets matures, the overall cell size decreases. Another thing that we look at is the presence or absence of nucleoli. And nucleoli are those structures inside the nucleus. You could see here kind of that roundish, there's a single nucleolus in this nucleus. So the presence of nucleoli tells us that we may very well be dealing with a blast or maybe the stage after a blast. Other things that we look at is the amount of cytoplasm. So generally speaking, younger, more immature white blood cells have less cytoplasm than more mature ones. And then the color of the cytoplasm, generally immature cells have a darker blue cytoplasm than more mature ones. Now, that what I just listed to you is a general description of how we can help categorize or name the various stages of white blood cell development. That doesn't necessarily apply. I mean, it can apply to myelocytic cells maturing and lymphocytic cells maturing. Now, what is unique about this blast is that it is about the same size as this mature segmented neutrophil. So myelocytic blasts, like myeloblasts, they're going to be much bigger. And, of course, the end phase or stage of a myeloblast is going to be the segmented neutrophil. So what's unique here is this lymphoblast is going to be smaller than its counterpart, meaning a myeloblast. So that's one indication that we're dealing with a myeloblast. Now, this very well could be a prolymphocyte, which is the next stage after a lymphoblast. It has a little bit more cytoplasm and a little bit more light blue cytoplasm than a lymphoblast would have. But if you're a tech on the bench and you see something like this, it's probably within your standard operating procedure that you would just call something like this a blast, and this would get referred to the pathologist, and then they would do the determination of what different stages these cells are at. So just to summarize or to go back, so what makes me think that this is a lymphoblast or a prolymphocyte is the fact that the overall white count is increased on this patient. The overall neutrophil count is down. Now, I don't have the analyzer printout, so it may be flagging, that these cells are blasts, or it may just say that there's an increase in the number of lymphocytes. And then just the way that this particular cell looks, the size of it, the fact that it has nucleolus, that it has not very much cytoplasm, cytoplasm's kind of darkish blue. All those things indicate to me that this is a lymphoblast or a prolymphocyte.